Going through the jurisdictions that have reported new cases, in the Australian Capital Territory, 1 new case was reported today, which was linked to the cases that were reported yesterday. In New South Wales, there have been 13 new cases reported. 11 of those were overseas acquired and diagnosed whilst in hotel quarantine. 1 was acquired interstate, and 1 was a contact of a known case. In Victoria, 165 new cases have been diagnosed, 30 were locally acquired, and 135 are currently under investigation. In Western Australia, 3 new cases were diagnosed. All of them were acquired overseas and diagnosed in hotel quarantine. Tragically, 106 people have lost their lives to COVID-19. 45 people are currently in hospital. 10 of those are in intensive care units. I wanted to make some comments today as both a respiratory and an infectious disease physician on the letter that was signed by over 200 scientists to the World Health Organization about the aerosolization of COVID-19. We know that with any respiratory virus, when people cough, when they sneeze, particles come out of their mouth, and they are full of respiratory virus. And those particles vary in size from very, very small particles that can remain suspended in the air, aerosolized, through to larger particles that tend to drop straight to the ground onto surfaces or indeed onto people if they are nearby. Respiratory viruses, and COVID-19 is no exception, have their primary mode of spread through contact and droplet. That is, that the overwhelming body of evidence suggests that the primary mode of COVID-19 getting from one person to another is larger droplets. Droplets that either fall onto people's hands and then you put your hands to your face, so that's direct contact with an affected individual who's very close, or alternatively, large droplets land on surfaces, sometimes on kids' toys and things like that. We call those fomites, and then people touch that surface and generally touch their mouths, and that's how the virus gets in. That is contact and droplet spread. So what about this aerosolization? Is this an airborne virus? The evidence suggests that the majority of transmission, the vast majority of transmission is contact and droplet. However, there are laboratory experiments that have demonstrated that some of those tiny airborne particles can still contain COVID-19. You can find evidence of COVID-19 within those particles that are suspended in the air, that can travel for longer, that can deposit on surfaces further than 1.5 metres away. What we don't know is how relevant that is to people actually getting infected. And I'll give you an example. 4 viruses that we know are transmitted via the airborne route: chickenpox, measles. If you're non-immune, then, and you're in the same room as a person, you are highly likely to get that virus, but even if you're 4 or 5 metres away. If I had measles during the course of this press conference, the cameramen, who are currently about 3 or 4 metres away, if they weren't immune, they would get it. Pretty much guaranteed. You'll be all right, fellas. I'm sure you've been vaccinated. For COVID-19, that is substantively less number of people will get COVID-19 if you're in the same room. In fact, the basic reproductive number is much, much less. So 1 person on average affects 2.5 others. That is much more in keeping with a contact and droplet spread. Now, our infection control expert group, who are the leading infection control practitioners, the vast majority of whom are current practitioners in our hospitals today. They're infectious disease physicians. They're infection control nurses. They're experts in this area. They constantly review the evidence and provide updates to the Australian Health Protection Principal Committee, the AHPPC. So whilst we keep a watching brief on this letter that's been sent, this concept of aerosolisation, it remains the position of the AHPPC that this is a virus that is primarily spread through contact and droplet precautions. That is not to say that we will ignore emerging evidence. We certainly won't. Our infection control expert group constantly look at the evidence. And if evidence emerges that this is more of a problem than we suspect, we will naturally change our position. But the overwhelming weight of evidence at this point of time supports contact and droplet spread. I would also like to indicate today and let you know that we have had ongoing discussions at the Australian Health Protection Principal Committee on the issue of community mask wearing in areas of high transmission. As you know, the position of the AHPPC has been and continues to be that in areas of Australia where there is no community transmission, 7 out of our 8 jurisdictions, we do not recommend mask use in the community. However, there is a part of Australia at the moment where community transmission is on the rise. Of course, that is Greater Melbourne and the Mitchell Shire. In those areas, mask use, surgical mask or cloth mask use is recommended if you find yourself in a situation where you cannot socially distance. This means that if you have to leave your home for any of those reasons for which it is permissible, and you are likely to find yourself in a situation where you cannot maintain 1.5 metres distance, it is advisable to be covering your face with a mask. That, of course, does not change our advice on social distancing. It continues to be the case that the most important measure that you can do to prevent the virus from getting from one person to another is to maintain your distance between individuals. That is the purpose of the stage 3 restrictions. It is the reason why they're going to work. They worked the first time, they will work the second time. And that's because we are keeping our distance from each other. Now, I've got a lot of people on the phone today, so I'll go through our 5 journalists on the phone, and I'll just take the liberty of repeating your question, if that's okay, so people can actually understand what I'm answering. So, Claire from the Daily Telegraph.
Thanks, Dr. Coatsworth. Just 2 things on the border towns between New South Wales and Victoria. So far, there's been 125,000 permits for people to cross from Victoria over into New South Wales. So given that huge volume of movement, how likely is it that COVID either has or will soon feed into southern New South Wales? And also in Albury, there's been about 350 tests done in the last 2 days. For a town of 50,000 people, is that the number you'd like to see given it's now a high-risk area, or would you want more people coming forward?
Well, Claire, thank you. The question is, given the 125,000 permits have been issued across the border towns on New South Wales and Victorian border, how likely is it that COVID-19 will spread into southern New South Wales? And given 350 tests in Albury, is that sufficient? So the answer to both those questions really Dr. Kerry Chant expressed the challenges, of course, of managing the movement of people between those border towns. It's why it's not a straightforward decision to close the border between New South Wales and Victoria. I note today, though, that the residents of those border towns are encouraged not to move into further north into New South Wales, and as for the number of permits that are issued, that of course is a matter for the New South Wales government. There have been cases already, of course, of COVID-19 diagnosed in Albury. There have been 2, and there was 1 on the New South Wales coast, and there have now been 4 in the Australian Capital Territory. So we have had isolated cases of COVID-19 already related to the epidemic in Melbourne. The most important thing, of course, is that people continue to come forward. New South Wales and the ACT have both introduced retrospective isolation for people who have come from Melbourne since June the 23rd, who are required to quarantine and isolate themselves for 14 days, and that's a direct measure to prevent further spread. We have excellent public health units in New South Wales and the ACT, as we do in Victoria, and so with those numbers being low and our ability to test, trace and isolate, that is exactly what will stop those small numbers from spreading within the community in New South Wales and Canberra. So we are certainly on top of those. With regard to the number of tests, the most important message to any citizen in any eastern seaboard state at the moment is if you are unwell with any symptoms, get yourself tested. And we know that the New South Wales and Victorian governments, in response to the cases as and when they arise, will increase testing in certain geographic areas, and Albury will be no exception. Thank you, Claire. I'll move on to Jade at the ABC.
Thank you. I just wondered if you could tell us the number of people on ventilators in hospital at the moment, and also just how the hospitalisation rate compares to the earlier stages of the pandemic.
So, Joe, that number does obviously change on a day-to-day basis. It can change on an hour-to-hour basis. My understanding was that the most recent number was 6 ventilated patients. It certainly remained less than 10 since the increased numbers of COVID-19 cases in Victoria. What this suggests is that we have more than enough capacity at the moment in our hospital system, even in routine business, to manage the number of COVID-19 cases in Victoria. So there is sufficient intensive care capacity, even at normal bed numbers, in Victoria at the moment. In terms of the number of ventilators, of course, obviously we know that the Commonwealth has procured 7,500 ventilators that are within the national medical stockpile. We know that individual jurisdictions have also got stockpiles of additional ventilators. We know that individual jurisdictions have their own plans on the actual amount of beds that they can expand to if they need to surge. But really, when we're talking about surging ICU capacity, it's not something that we talk about when there's only less than 10 patients on ventilators and 10 in ICU in intensive care down in Victoria at the moment. So that is something that happens when your intensive care really does start to get full of patients with COVID-19. And of course, you have to be able to maintain business as usual, and you have to provide intensive care for those patients who don't have COVID-19, who will continue to come into intensive care despite the epidemic. So whilst we're keeping a close eye on the number of patients in intensive care, it is well within the system's capacity at the moment to deal with. Tamsin from the Herald Sun.
Thanks, Doctor. I was just wondering, now that Victoria is introducing temperature testing of all students as they return in coming weeks, what's the advice from the AHPC around the effectiveness of temperature testing, and are there any other scenarios where you would like to see this kind of measure rolled out?
So the question relates to the temperature checking policy that's been introduced for Victorian students coming back to school. As you know, the AHPPC has stated in the past that the value of systematic temperature checking is limited in actually trying to find cases of COVID-19. It's not that you won't find any, it's just that not everybody with mild COVID-19 mounts a temperature, and sometimes people have temperatures for reasons other than COVID-19. That said, though, some of this is also about focusing people's attention on the need to isolate when they're unwell. One of the advantages of temperature checking, independently of whether you're diagnosing COVID-19, is that it is a very visible reminder of the issue at hand, a very visible reminder of the need to stay at home when you're unwell. I can tell you that even in the ACT, at the school that my children go to, they've been having their temperature checked last term. So when there were no community cases in the ACT, as a parent, it very much reminds you that if your child has a sniffle, they might not have a temperature, but if there's a teacher there pointing a thermometer at their forehead, of course, it reminds you of the policy, which is to keep your child at home when they're unwell. So the implementation of that policy is entirely up to the Victorian government, but that's some of the reasons why temperature checking can be of benefit. And I'll go to Dana McCauley. Dana, are you there? I can't quite hear Dana, so I'll move on to Kristen from the Canberra Times.
Hi, I just want to ask you about the pilot scheme to bring international students to the ANU, which has been abandoned for now. Was that on the advice of the Chief Health Officer? Was any advice sought on that? What comment would you make about that? And when do you envisage it being safe for the international students to come either for a pilot or more broadly?
So the question was whether the abandonment of the ANU pilot student scheme was on the advice of the AHPPC. So, Kristen, the AHPPC has been looking at the hotel quarantine policy, and that is going to be, our review of that is going to be presented to a National Cabinet. We have obviously taken an interest nationally in the AHPPC throughout government on the number of people coming in from overseas. The main focus has been on Australians, permanent residents and citizens who are seeking to return at this point in time to Australia, and the capacity of our jurisdictions to be able to manage those numbers, which have been significant. Over 60,000 people have been in hotel quarantine, and that is a burden on jurisdictions, on jurisdictional public health services, and at a time when we are focusing on containing this outbreak, it is right and proper for us to consider the volumes of people coming in from overseas. So from that, you can infer that that is not just Australian citizens, but international students as well. In terms of the timing that we would be able to consider that, we very much need to see the epidemic in Victoria be brought under control, and again, it'll be the day-to-day numbers and watching the trend in the coming weeks that will enable us to answer that question. And I'm sure people are still online, so if you do have other questions, I'm happy to take some more, maybe two more. Oh, Dana. Sorry, to clarify that what you've said there, then, as I understand it, is that the committee did advise that pilots should be cancelled on the basis of the capacity in hotels. No, the AHPPC didn't provide specific. The AHPPC did not provide specific advice on the cancelling of. Sorry, the phone's on the blink. The AHPPC did not provide specific advice on the cancelling of the ANU pilot program. Dana. Okay, now I think it's time, given the phones are a little bit problematic, that we wrap up the press conference today. I'd like to thank our interpreters, and we'll be back with an update tomorrow. Thank you.